Gloucestershire-based actress Emma Sams has been suffering with extreme fatigue and a shortness of breath for over a year following COVID-19. Today she heads into Gloucester to meet with healthcare professionals behind the Post-COVID Syndrome Assessment Service provided by Gloucestershire Health and Care NHS Foundation Trust, in hope to hear of how the service will bring much-needed support for long COVID sufferers.
Dr. Charlie Sharp, tell us about your area of expertise.
So I'm a respiratory consultant, which means I work with people with chronic lung diseases and acute lung diseases, and through the last 2 years become obviously involved with coronavirus and people with COVID infections acutely. And then when we realised that there were quite such after effects from COVID, I was closely involved in development of the long COVID services in Gloucestershire.
So my name is Cassie, I'm a physiotherapist. I'm currently the clinical lead for the long COVID service in Gloucestershire.
So my name is Michelle Phillips, I'm a GP and I've recently joined the Post-COVID Syndrome Clinic, treating patients holistically, and felt really that we just needed to be doing more for long COVID or post-COVID, and so I was delighted when this opening came up that I could be involved in the clinic.
Can you describe the condition?
Long COVID's a really diverse set of multiple different ways of presenting with symptoms, involving breathlessness, fatigue, brain fog, chest pains, fevers, a whole host of different things. But the key feature is that it's persisting symptoms after a presumed or confirmed acute COVID infection, and symptoms lasting more than 4 to 12 weeks. And for many patients, they're still having symptoms 18 months down the line.
I am. The symptoms are so wide and so varied. I mean, let's try and list them all if we can. There's the breathlessness.
So obviously I see patients with breathlessness, with chest pain in a lung clinic, but there are multiple nerve-related symptoms as well, so headaches, weakness, pins and needles tingling. People have gut disturbances, so chronic diarrhea, sometimes 10, 12 times a day for some patients. Chest pains, and there have been heart complications as well. The fatigue is a really profound symptom, as is brain fog, so really difficulty concentrating, difficulty thinking.
Now fatigue, let's talk about fatigue. We've all experienced fatigue, you go out for a run, you come back and you're fatigued. This fatigue is different.
It affects many different parts of the body and many different symptoms. So fatigue makes me think a bit about tiredness, but this is way more than tiredness. This is absolute exhaustion mode where you literally cannot get up. But also the other associated symptoms, it might be headache, it might be sinus problems, it might be pain, burning sensations, and it is more of a syndrome. There's lots of different symptoms coming together. For some people it might just simply be just the fatigue, but for other people it might be a myriad of symptoms. Ways of managing fatigue is talking about making sure your battery is always fully charged. And this isn't a nice new smartphone battery, this is an old battery that takes all night to charge up, and once it starts to drain its battery it starts to go really quickly and then takes a long time to charge up again, and making sure that your battery has always got some charge in it so that you're able to keep going, and it's been able to stop and put it on charge on a regular basis to keep the energy going, and it's no longer a phone which can keep going for 2 or 3 days.
Sometimes the best way to describe it is, I find I'm lying in an uncomfortable position and I'm too tired to move. I can't summon up the energy to move into a different and more comfortable position. That's how fatigued you feel.
With tiredness you can generally keep going. Fatigue will stop you.
There's so many symptoms, up to potentially 200. One individual varies from another. There isn't a test to diagnose it.
Who are the most likely people to get long COVID?
What it seems is the most common groups are those in their middle ages, so their 40s and 50s, particularly women, and we're missing people who aren't coming forward with these symptoms because they're not being asked. And so raising awareness of long COVID for those who might benefit from any services that are built and might need extra support is really important. There's a multitude of different views about what the right approach is to managing the symptoms. But actually, what we have to acknowledge, and the reality is, we don't know what the right approach is. And as I've said, this is a diverse set of patients. We're talking about people who've been in the intensive care unit, been critically ill, nearly died from their acute COVID, and they've got lasting symptoms, all the way down to people who didn't have that much in the way of symptoms from their acute COVID, but are completely debilitated, unable to function, unable to work, with their persisting symptoms after COVID. That's going to be due to a multitude of different things, and different symptoms and different patients will need different treatments, and it needs to be tailored. One size doesn't fit all.
A lot of people find that writing lists are really helpful, so they can actually think about, right, this is all the things I need to do today. How am I going to plan it in today? How am I going to plan it in this week? What's important to do today? What can be done today? What can be done another day? And then what's the impact of that? If I want to go and do this event or this day, how am I going to manage the rest of the week? So it's planning in rest either beforehand, afterwards. And this is one of the few times I say, don't listen to your body all the time, and exercise won't necessarily fix everything this time, which as a physiotherapist that felt quite hard to say initially. And it's not saying that exercise is bad, but it's about saying it's the right level of exercise, the right amount of exercise, and at the right time. Many times, if you were that unwell, you would have been admitted to hospital, but the hospitals were reserved for people who were really, really unwell. So many people were at home with a condition that they didn't really understand, and actually having somebody who they can just talk to, not just about the physical side of that, but actually the emotional side of that, I think is really quite important. And having that in a safe space to talk about that, someone to actually understand and to be able to validate, it's okay to have been scared, to have been frightened, to have felt lonely. Part of managing and living with long COVID is trying to keep emotionally well.
One of the vital things is acknowledging that this is a condition. Just because tests are normal doesn't mean that there isn't something going on. It means that we can't find a test which finds what's going on. Symptoms and clusters of symptoms always reflect something which needs support, needs to be explored. It may not be something to which we can attach a number, and ultimately that's all that tests do, is they attach a number to things. But with exploration, with support, but listening is the key thing that clinicians can do, is to listen, to give space to hear what patients are saying, what people with long COVID are saying, is vital.
I would suggest that anybody who thinks that they have long COVID symptoms contacts their GP. The GP will want to explore further the symptoms that they have. Most likely will want to examine the patient and also potentially perform some tests. These tests typically will be blood tests, maybe a chest x-ray, possibly a tracing of the heart. And these tests are used to try and rule out other conditions that may be causing the symptoms that you have.
The GP will then refer to us to say, I don't think there's another cause for these symptoms. I think these symptoms are because of long COVID. And that's at the time point that we receive the referral.
Initially, when a patient is referred to the clinic, they'll be sent a questionnaire, and this explores further the symptoms that they have, so in greater detail than is done with the GP. Also puts their symptoms into context of their life and tries to explain to us really where that patient is up to and how life is at the moment with these symptoms.
There's a lot of expectation. People are very excited. Finally, somebody is going to talk to them at length, in full, about all of their different symptoms. Making them have a realistic expectation of what they're going to get from the clinic is important, yes?
Yeah. Unfortunately, there's no quick fix. And it is about helping someone to understand their condition and the journey going forward.
One thing I think is valuable and what we've been doing in Gloucester, or trying to do, is listening to people with lived experience of long COVID to help develop services. So people from the clinical commissioning group have been talking to patient groups to try and make sure that what we're doing is going to work, is going to give the best value and actually be what patients need.
There's going to be a lot of us there, aren't there?
There are many people, and I think there are more people than we know about, because I suspect that a lot of people are suffering in silence.
I'm sure there are a lot of people out there whose partners, whose workplace, whose family don't get it.
No. To be fair, workplaces, not understanding what this is. How long is it going to go on for? Is there going to be a cure for it? When are you going to be back? Can I make adjustments for you? Can you be at work? Can you not? Is it infective? Is it not? This is quite a devastating illness, and the effect it has on people's lives is massive, and it's ongoing, and I think anything we can do to help support patients is going to be really worthwhile.
There are a lot of resources out there to try and help people understand what long COVID is. On the Clinical Commissioning Group website, there's a battery of resources. One other a good resource to look at is Your COVID Recovery. There's also patient groups and a plethora of stuff out there, but a good place to start is the CCG website.
There's going to be a huge number of people with long COVID around the world.
So the estimate for the UK at the moment is somewhere between 1 and 2 million have persisting symptoms after COVID, which is just a completely incomprehensible number.
Is it real? Absolutely it's real. Absolutely it's real. And all those people want to get better and want to work hard at getting better, and it's really hard when you're saying, actually, you have to slow down. And that's the challenge, I think.